think one of the things that we've always focused on as a residency program are really making sure that people can train to do whatever it is that they want to do, wherever it is that they want to do it, even if they have no idea what that is when they come to us. So what I mean by that is we prepare you to practice emergency medicine in any setting, whether that's a large quaternary academic center, which is where we train people at our primary site, or if you want to learn to work in the middle of nowhere with limited resources, we have a robust option for rural rotations that I think differentiates us from a lot of different programs. So I think what kind of things people will see here may surprise them a little bit. So at our primary site, Ruby Memorial Hospital, it's a large quaternary care center. As you alluded to, we have a catchment area of about 1.2 million people in north central West Virginia, western Maryland, southwestern Pennsylvania, even into eastern Ohio. So as the primary referral center, we're a level 1 trauma center. So we see about 5,000 trauma alerts per year. The majority of those are blunt, but we still have a fair percentage of penetrating trauma as well. And rest assured that you'll be very well capable of taking care of trauma patients when you come through our program. Then you do 2 months in both your second and third year and a month in intern year at United Hospital Center in Bridgeport, West Virginia. It's about 35 miles away from Morgantown. It's right off the interstate. You get to the top of the ramp. You can see it from the exit ramp, so it's not a hard place to find or get directions to. And it's a really great community emergency department. So they see 50,000 patients a year, and that's where you can get really good at taking care of people that present with flank pain and end up having a kidney stone or pyelonephritis, or people coming in with chest pain and trying to learn to differentiate whether those people are having a heart attack or not. And you see those things at Ruby as well. It's just, I think you see the more run-of-the-mill sort of bread and butter emergency medicine at our community site. And then we have a great opportunity that is an elective opportunity. So no one is required to rotate through our rural sites. But our department has sort of control or ownership of about 23 emergency departments throughout the state of West Virginia. And the residents are able to rotate with board-certified physicians at a number of those places. And some of those places can be a small, I always use the example of Braxton County Memorial Hospital, where they have like 6 beds in the emergency department and 12 beds in the hospital, and you are both the emergency physician and the hospitalist, and you're there working to, the same things that come to Ruby or UHC come to Braxton County, but you're learning what you do when you're the only doctor in the hospital, or you might not have the equipment that you're used to, and learning what people can stay in that setting, and you can partner with the primary care physicians in that community to help them stay local, or those things that have to go out. And I think as emergency medicine is shifting nationally, one of the things that we have to train our graduates to be really, really good at is learning to care for people that might be in the emergency department for a period of time before a transfer and admission. And I think this is a unique opportunity to be the sending physician, and sort of what happens if there's a 2-day bed delay, and how do you manage that patient over the course of time. And that's going to position you exceptionally well to practice in rural, community, or academic settings in your future. So I think the community is great. I think one of the things I love about Morgantown is it's a small enough place that you can sort of gain meaningful connections with people, but it's big enough to have all the bells and whistles that you would have in some of the larger cities. From a program standpoint, I think we really emphasize the program as a family environment. I think we are welcoming to people from all walks of life, people that have children, don't have children, people that grew up in different backgrounds. I think we really emphasize including everyone, and we have, a variety of ways of doing that. Our program leadership's available anytime, via text, phone call, email, to really help and be there as a resource for you when anything arises. We're always looking for people that want to be part of something larger themselves and want to be part of a team and help out their fellow residents, because life doesn't stop for residency. And so when something in your family happens, I promise you we will get you home. We will make sure that you are where you need to be. And your colleagues will be there to help you out with a smile on their face. And then you'll be there to help out your colleagues when something happens in their life. So I think the advantage of our program in a lot of ways is that we are small enough that we're going to get to know you on an individual basis. We're going to celebrate your strengths, and any residency program, including ours, that you match in is going to give you unconditional love. We're going to support you through your challenges. We're going to help you achieve whatever it is that you want to achieve and make you better than the generation before you. And I think our program is laser focused on that. So we will get to know you. We will, as I said, celebrate your strengths, help you with any opportunities for improvement, and have an opportunity for individualized education. And we're not just focused on producing academic docs or community docs or sending everybody to fellowship. We really want to help you do exactly what you want to do, not what the world wants to tell you to do or what you feel pressure to do. And I think our track record speaks for itself on getting people to all of those settings. About a third of our class on average every year will go into fellowship. Another third will go into academic practice, and the final third will go into community practice. And I think while that varies from year to year, it just speaks to the fact that we have a really healthy environment of mentorship and encouragement and support for residents.